Hello, EMT student. My name is Paul Bedell. I'm one of the adjunct faculty here at Pima Community College. I'll be going over today Chapter 7, Lifespan and Development. So I will go ahead and remind you to please take notes. If you have any questions, bring them to the instructor that next day you're in class, and we'll be able to cover that information the first hour of class. All right, getting good at this now, but I'll start sharing the chapter. There we go. Make sure this is out of the way. All right. So, lifespan development. Humans develop throughout their lives, from birth all the way to the day we die. We have to be aware of the physical changes a person undergoes at various stages of life. I've been talking about that throughout this chapter. It may alter the approach of patient care. So we got to be specific in the type of questions we're asking to ascertain what's actually going on with that patient. Was this a diagnosis, something they were predisposed to, something they were born with? That's why we got to do our investigative questions to find out what kind of care I can provide and what kind of interventions we can do. So at first, we talk about the neonates with newborns. Neonates are going to be from birth to that first month, and then infants start from that first month up to a year. And it develops at a startling rate. We'll talk about this. The younger the person, the faster the pulse rate and respiratory rate are. So at birth, pulse rate's about 90 to 180 beats a minute, and respiratory rate 30 to 60 breaths a minute. And that's basically normal. It does drop shortly after birth. The pulse rate can be between 100 to 160, and the respiratory rate 25 to 50 breaths a minute. At 1 year, the respiratory rate does drop down to about 20 to 30 breaths a minute. Now, blood pressure, it directly corresponds to their weight and typically increases with age. So, weight of a neonate, 6 to 8 pounds at birth. Again, there could be a preemie, it could be less than that, twins, and then it could also be heavier than that weight. So it just depends. This is on average. The head accounts for 25% of that newborn's weight. And they grow about 30 grams per day. So when you're talking to a parent, caregiver, whoever's there with that baby, right? And you're asking questions about, why are we there today? What's the complications? Are they growing normally, eating normally, pooing and peeing normally? We got to ask those type of questions to find out what is the complication and what's the problem with that child. So we're going to talk about parts of systems as they grow and develop, seeing the changes of these systems. So starting off with the cardiovascular system. At birth, the neonate makes transition from the fetus to independent circulation. They're finally gaining their own independence with the cardiovascular system and not having to rely on mom. Pulmonary system, infants younger than 6 months, they're going to be prone to those nasal congestions, drooling, all the muco building up, right? The rib cage being less rigid and the ribs sitting more horizontally. Infants have larger tongues and shorter, narrower airways. So airway obstruction is more common. Even when they get to a point where they're able to pick up an object they see on the ground and they want to just test it, right? And they're putting it in their mouths, it doesn't take much to wedge into that airway because of the narrowing of that airway. So again, with foreign body air obstructions, we've got to be assuming that they put something in their mouth, right? So we got to look for that. When providing bag valve mask ventilations for these neonates or infants, remember that the infant's lungs are very fragile. So there's a risk that with your positive pressure ventilations that you're providing, you could cause damage to those lungs. How about the nervous system, right? It continues to evolve at birth. And we're going to talk a little bit about these 4 examples. Moro reflex, thinking of the word more. So they're grasping out their hands and arms and kind of reaching for something, wanting more of it. Palmar grasp is when you place something and touch the palm of their hand, right? They want to try to grasp onto it. Rooting reflex, when you touch the side of their cheek, they go, what's that? Where is it? I want some of that, right? And then the sucking reflex, when you touch the lips and they start to do the suckling technique, right? So how about the fontanelles, dealing with the cranium and the structure of the head, right? Protecting that brain. So the anterior, posterior is what we mentioned here. 2 different parts in the textbook, it covers this, but ideally 9 to 18 months is when they finally will fuse in the anterior portion. and 3 to 6 months for the posterior portion. So what about the immune system? The infant's immune system maintains some of its mother's immunity, right? Either through breastfeeding, the mother can still, aid and assist the infant's immune system because of that, but eventually that infant will eventually fend for themselves. When it comes to psychosocial changes, changes begin at birth and they will eventually start to evolve. If you've had yourself gone to a pediatrician, I'm assuming at some point in your life as a younger child, there are charts that pediatricians have, of course, talking about lifespan development. They should be of this height, this weight, the size of their head, and type of words they're speaking, and motor skills and stuff, right? So talks about here on 7-2, these are tables in every one of your chapters, right? So chapter 7, table 2, it talks about these age ranges and what are some of the characteristics of that baby during these months. Some other changes will be crying is the main method of communication. This is why at a certain point in age, some parents will start to teach their babies maybe some basic sign language. So that frustration of, you're not understanding me, I want something to eat, or I poop my diaper, they can communicate that through sign language. So crying is basically, hey, I'm crying because I'm tired, crying because I want to get out of bed, I'm poopy, hungry, whatever it may be. That's how they communicate. Bonding is based on a secure attachment. So it's very important to have that secure attachment as a parent to be able to have that bonding with that infant. And it starts early on. So if you work a lot, you have a caregiver taking care of the baby, maybe it's a single parent, whatever it may be, and later on a new significant other enters the life, new spouse, whatever, there's not a secure bond there, right? And then early on, there may be some anxious avoidance attachment when the baby was constantly it may not have been intentional neglect, but it was being neglected in some way emotionally or physically, and that baby never gets that secure bond with that parent or caregiver. And that children will show little emotion to that parent or caregiver. They would basically show the same emotion to you responding to that home for the first time as they would with their own parent or caregiver. Separation anxiety is kind of that opposite, right? It's common in older infants. They don't want to let go of their mom or dad or their caregiver, whoever it may be. They know they have a strong bond, and now a stranger walks in and tries to separate them. They'll get a little upset with that. That's why it may be important to take that parent or caregiver with you to the hospital, so it's that baby at ease. Trust and mistrust involves needs being met. So again, it's very important that the parent also knows that the needs are being met, and there's more of a trust there between you and the parent also. Moving up in age, we got toddlers and preschoolers. Toddlers being 1 to 3 years of age. Now we're going to talk about their vitals here again. Pulse, 90 to 150. Respiratory rate, 20 to 30. Systolic blood pressure, 80 to 100. And their temperature, even 96.8 degrees Fahrenheit to 99.6 degrees. The preschooler age being 3 to 6 years of age. Pulse rate is going to be about 80 to 140. Respiratory, 20 to 25 breaths a minute. And their systolic blood pressure, 80 to 100. We're just, again, talking about systolic blood pressure, that top number, right? For toddlers and preschoolers, they do not have well-developed lung musculature yet. Prevents them from sustaining deep or rapid breathing for extended periods of time. So it's a lot different for them when they take a deep breath, simply blowing out their candles, holding their breath underwater for periods of time when they're going swimming, whatever it may be. They cannot go as longer as a fully developed adult would be. The passive immunity is lost. Okay, now they're really going to be fighting for themselves now. They're pure independence, right? More viral infections develop as GI, gastrointestinal distress, or upper respiratory infections. The neuromuscular growth makes considerable progress. So muscle mass and bone density start increasing. They're starting to walk around and move and investigating things, running, climbing, whatever it may be, right? They're very independent now and moving around. So this is why we gotta secure things and lock up the medicine cabinets and whatever it may be that they may have access to, the pools, make sure the gates are closed, because they're constantly moving, growing, developing, but investigating. They want to see things and grab things and taste things and touch things, and it may be dangerous for them. The psychosocial changes here, learn to speak and express themselves either through sign language. Again, they may speak multiple languages. Who knows? They may not speak your language. You got to get an interpreter through maybe the parent, hopefully can interpret for you. Master the basic language at 36 months. Again, basic language of basic sentences. We're not going to share our medical terminology with them, of course. When we think there's a problem, we're not going to try to use the big words. We're going to simplify it, of course, so they can understand what we're talking about. Interact and play games with other children. This is where we start getting that problem of sharing and spreading certain diseases and stuff, because they're always in close contact. They may not be the best at good hygiene techniques and stuff, so it's constantly being reminded from the parent, caregivers, or preschool teachers, whatever it may be, that can help them and remind them about, keeping distances and washing hands and, coughing in your elbows or whatever it may be. Begin to understand the cause and effect by 18 to 24 months, and learn to recognize gender differences by observing their role models, observing other friends or family members, whatever it may be. They ask those questions. They are curious. They want to know. Right, the school age children, 6 to 12 years of age. Now the vital signs start to approach those of an adulthood age range. Pulse rates are going to be about 70 to 100 beats a minute. Respiratory rates, 15 to 20 breaths a minute. And the systolic blood pressure, about 80 to 110. Obvious physical traits and body function changes become a little more apparent. Growth of 4 pounds to 2.5 inches each year. Again, this is on average, right? They could gain more weight, less weight. They could grow that much faster to maybe not as fast, right? The permanent teeth come in. They're losing all those baby teeth. Brain activity increases in both hemispheres. Again, this is good. They're developing, right? They're going to see their pediatricians annually, of course. Hopefully that's all they need is just an annual checkups and stuff through their pediatrician, right? Hopefully they're doing that so the parent or caregiver has good information for you on how they're developing. And then the changes here, the pre-conventional reasoning, acting to avoid punishment and get what they want. So you'll start seeing those type of changes. Now, again, how is this really affecting the type of care we're going to provide when it came to them falling downstairs, falling off their bike, some medical complication that they have. But when it comes to something that they shouldn't have been at the park, that's where the event occurred. And the parent didn't know that when they came back in the house, So just realize that these are the type of, evolving type of psychosocial changes that they're going to be going through. Me as a parent, I've experienced these with the 4 children that I've had. So it kind of, instills it and I understand a little more because of that. So again, pre-conventional. The conventional reasoning, looking for approval from their peers in society. And it makes sense once they start going to the preschools and they start understanding they have the friends there, right? And they go, I want to see what, they're doing and how they interact with them. And they want to get their approval, so they kind of have that type of reasoning. And then post-conventional reasoning, make decisions guided on their conscience, their little Jiminy Cricket. Self-concept and self-esteem start developing, right? Are they happy with themselves? Are they being told that they're ugly? Are they being told that they're, cute, skinny, fat? I mean, are they being told whatever they're being told? Are they understanding that they have to have their own self-esteem? I am fine the way I am. I am beautiful. I'm handsome the way I am. And not have that bombardment of negativity from peer pressure always being instilled in them. Hopefully they don't have that experience and they're being told all this positive information about their well-being, and therefore they have a good foundation of self-esteem for themselves. All right, our adolescent ages, 12 to 18 years of age. Some of you just left this, I bet. So the vital signs start leveling off, basically that adulthood range, right? 60 to 100 beats a minute. That's basically a nice resting heart rate for adults. The respirations, 12 to 20. Systolic blood pressure is 90 to 110. Very, very similar to adulthood. They get 2 to 3 year growth spurts. Again, most cases. Girls finished about 16 years of age. Boys about 18 years of age. Just remembering there's growth plates that, these doctors can take x-rays on. If there's still some space there within that growth plate, then they'll know there could be some opportunity for further growth. Once that growth plate is all filled up, if you will, that's their height. They've maxed out or whatever height that is. Reproductive system even matures. Secondary sexual development takes place. When you got pubic hair development, from hair growing in spots that we normally didn't have hair growing in just prior to this, right? Even breast development, sperm production in men, or boys, I should say, and egg development in girls. This is all happening in this adolescent age range. Their voices start to change. Menstruation can even begin. So this is why a parent or a caregiver should be talking to their children about this and explaining to them these changes in this adolescence. They would be understanding this type of information because of their age and their developmental changes. And that's why good open communication is important. Because if you have to respond and you're trying to explain, because you respond to a girl and she had some bleeding in the vaginal area and she's confused, she goes, I wasn't hurt, no one kicked me or anything like that, I don't know what's going on. You say, well, is there a possibility you're going through your menstrual cycle? She goes, what's that? That would be a challenge to treat that patient, right? That information should have been, provided through good open communication with parent, caregiver, or whoever, again, is there with that child. In some of the changes here, the adolescents and their families often deal with conflict. Oh, I'm sure there's a perfect family out there that there's no conflict whatsoever. And I'm sure there's families that have conflict every single second of the day. Privacy becomes an issue, right? They want their privacy, they want their independence. Leave me alone, stop bossing me around type thing, right? There has to have that earned respect, both sides. Self-consciousness increases. Adolescents may struggle to create their own identity. Okay, they may change different things. I want to wear, jewelry, piercings, maybe even the tattoos, possibly, depending on how the parents or caregivers allow this. They may dress and change differently. Makeup, no makeup, whatever it is. Clothing changes, whatever it may be. They're trying to find that identity. Allowing them to express themselves, I feel, is a very good thing, right? I'm sure parents or caregivers have limits, though, to those expressions. And they wanted to be treated like adults, yet be cared for like younger children, of course. Antisocial behavior, peer pressure, peak at 14 to 16 years of age. I would hope they never have to experience peer pressure. I would hope their friends and whoever they hang around with are all wonderful, perfect people to help support society, of course. But there's just that possibility. Sometimes they may have some peer pressure and they want them to experience different things, right? If you have good, constant communication with parent, caregiver, and this child, those type of things should be talked about. Again, once we're involved as EMS providers, right, we're there because someone's having a bad day. It was either something medical or something traumatic in nature. We have to talk to them about certain things. Is there a possibility of drugs or alcohol, sexual activity? We may have to ask these type of questions without the parent or caregiver around, possibly. Try to get them on our side, building that type of rapport with that patient. Smoking, illicit drug use, unprotected sex, eating disorders, right? You have to find out if these things are going on with them. Code of ethics developed, based partly on the parents' ethics and values while they're growing up and instilling that in their children, right? And partially on the influence of the environment they're in, right? Whatever other friends and stuff that they're hanging out with. Until they build that foundation, right, that they are following that path on, hopefully that nice and straight and narrow path. High risk of suicide and depression. So hopefully, again, I keep plugging parenting here, I know, but parents and caregivers, they're communicating with their children, open forum, no one's getting in trouble here. There's constant communication and not have to find out later that they were posting something on social media about, their life is miserable, they want to end it, whatever it may be. And then if that is the case, though, hopefully they have good friends or other people that are on that social media reading these things, recognizing it, and maybe they're talking with that, adolescent, or they're talking with that parent or caregiver of that adolescent child, about those type of posts. All right, enough about kids. Let's get into the early adulthoods, 19 to 40. Yep, a few years past that. Vital signs do not vary greatly. Pulse rate, 70 on average, and it ranged between 60 to 100 beats per minute. Respiratory rate stays in a range about 12 to 20, just like the early adolescent range was. Systolic BP, again, 90 to 140. And then from 19 to 25, the body should be functioning at optimal level, optimal performance. Should be. Again, there are cases where from either obesity, chronic problems, other types of things that were slowly either acute or over time chronically building up. But ideally, that's the optimal level of performance during that age. And the psychosocial changes, life centers on work, family. I'm not a big fan of stress, meaning, yes, I know there is situations in your life that tend to be good or bad, but it affects your life in a way that can cause more, you know, difficulties and stuff. It's really how we deal with it, though, right? Loss of a job to a promotion, both can be stressful, right? Even though you think one's positive, one's negative. Losing a bunch of money in stocks to winning the lottery, both can be very stressful, right? So it's just how you deal with what life presents to you. Settling down, hey, starting a family, right? If that's what you're into. Love, childbirth, right? I don't think I'm gonna be doing much childbirth, even though it may look like that, but childbirth from you and your significant other that you're with, maybe adoption. Again, these are the family type of thing, maybe something that this age range is starting to develop and getting into, right? One of the more stable periods of life. So just because this is what the data shows, it doesn't mean that if you want to be single for your whole life, that's fine, okay? You want to be nothing but a work-minded tiger and you're just trying to get a career going and own your own business, that's fine, right? It's how you're dealing with it. What kind of healthy lifestyle are you living, right? Getting enough rest and exercise and good diets and stuff. Doesn't have to be that I have to have a family, have to have children or whatever. So please don't think that because you're not at that stage and not having children yet, oh no, I'm behind the curve. Not always the case, okay? All right, the middle adults. Give a shout out to middle adults here. 41 to 60. Vital signs are gonna be the same. Vulnerable to vision. Yeah, vision and hearing loss. Cardiovascular health becomes an issue. Cancer incidents start increasing. You got to get checked. I mean, if you see that one mole that wasn't there before and it's starting to walk around your back or chest area, maybe you should be talking about that, right? Checking for things, right? Self-exams are very, very important. Plug for that. Menopause occurs in late 40s to early 50s. It even can be earlier, early or late 30s, I can say, to even later on past the 50s, depends. Diabetes, hypertension, weight problems, okay, can always be an issue. Man, I just can't eat all those big macs like I used to eat. Okay, it goes right to my hips. Exercise, healthy diet, sleep, very, very important. Focus on achieving life goals, whatever those life goals are. It doesn't have to be, family. It doesn't have to be the career. Just whatever your life goals are, okay, and you want to try to achieve them. Readjust lifestyle as children start leaving home. Yay, right? Once they start leaving home, become an empty nester, right? Now we can start focusing on a career maybe, right? Or we want to change the career. We want to travel, whatever it may be. These are going to be some changes. Finances become a worrisome issue. Well, you would think with all the children now out of the house, maybe my income should start, increasing, right? I'm not spending on children all the time, but you're going to have that concern about it, right? Maybe your job isn't there anymore. Now you got demoted or whatever. Generally have the physical, emotional, spiritual reserves to handle these issues. You've been there, done that, right? We've had these type of experiences before. So I should be able to cope with these type of things. Maybe caring for children leaving for college. Still the case. Maybe you're still paying for those type of things, right? They're not getting scholarships or whatever. And those are those financial concerns that we have, right? Along with aging parents. So now you're still caring for children that are moving out, but maybe parents are moving in. Whatever that situation is, you may have to deal with that, and they might cause some stressors in your life. And then lastly, with the older adults, 61 years and older, the life expectancy constantly changing. And there's a lot of factors involved here, of course. What type of lifestyle are they living? Now it's about 78 years with a maximum estimated age of 120. Didn't make that up, it's right out of the book. Their vital signs, depending on their overall health, medical conditions, medications taking, right, with polypharmacy. They may be taking a lot of medications. The older adults are often able to overcome numerous medical problems, but may need the multiple medications to sustain a healthy lifestyle. And that's okay, right? There are some that don't take any medications whatsoever, and they probably run triathlons or Ironman winning that and stuff like that. Run circles around all of us, right? And they're maintaining that healthy lifestyle and living to that 100+ years of age. Their cardiovascular system, though, again, eventually we do start breaking down. We might need some tune-ups, whatever it may be. So it's going to start declining with age, largely due to all the, if you have unhealthy lifestyle, not eating very healthy, all that fatty deposits and plaques and stuff building up in the blood vessels and stuff, that's going to have some problems with the cardiovascular system. The heart rate and cardiac output start decreasing. It's not pumping the way it used to. Cardiac output can no longer meet the demands of the body. I'm saying I just can't keep up with it. Sorry. Vascular system becomes stiff. So with the filling up the plaque and fatty deposits in the plumbing, same thing with that plumbing, it becomes more brittle. Okay, and then the plumbing can start to break and leak. And then the heart may have a harder time to even move the blood effectively. Ability to replace blood cell declines. So even after injuries, at a younger age, I could heal with no problem whatsoever. I had a break and boy, I recovered from that in a few months. Now, a simple, a break to bruising and bleeding, it's just harder for me to heal. And then as does the blood volume. Okay, so it's harder and harder to recover from these ailments. It's harder and harder to recover from these traumatic events as we get older. Respiratory system, size of the airway starts to increase. The surface area of the alveolar sacs, they decrease. So again, oxygenation is going to have a problem. The natural elasticity of the lungs decreases. Breathing becomes more labor intensive. I just struggle to breathe. It's just a struggle all the time. I'm just out of breath. I'm tired all the time from it. Aspiration, they tend to want to, when they're lying down and trying to sleep and stuff, they may cough and phlegm building up, and they're always going to be trying to aspirate and breathe in that type of phlegm and stuff. So that's a problem, right? They want to sleep sitting up in some cases. Maybe they sleep in their lazy boys, possibly. So that's going to be a problem with obstructions, of course, of the airway. Vital capacity decreases by 50% of that of a younger adult. Half. Loss of respiratory muscle mass. Increased stiffness of the thoracic cage. So again, taking those deep breaths, coughing up, whatever it may be that normally would do, it's harder and harder to do it now. Decreased surface area available for air exchange. So again, residual volume increases. So whatever air was normally taking in with the tidal volume, we'll say 500 milliliters, whatever air is taking in all the way down to the alveolar sacs, the alveolar sacs aren't diffusing as well as they used to. Then you're going to have leftover air, the residual leftovers that was not used in that diffusion process. So I'll have increased levels in the dead space. And then when you exhale to get rid of all that waste, hopefully, but all the dead space also, you're not being able to get rid of it all. So you're retaining all the waste products too, all the carbon dioxide even. So again, become hypercarbic. So very significant when it comes to hypoxic issues and even hypercarbic issues because you're not able to perform adequate respirations. How about the endocrine system? Insulin production starts to drop off. You're not producing as much insulin as you used to, and therefore it may become the type 2 diabetic, but you're just not unlocking those doors to the cells to give them the nutrients, the energy, the oxygenation, again, the blood flow that those cells need, right? So that insulin is really key for that. Metabolism decreases. I just can't eat what I normally ate. That aerobic metabolism that is usually done with normal oxygenation starts to decrease or decline because you're not getting the oxygenation, and therefore it's going to start kicking into that anaerobic metabolism, building up more of the lactic acids and the pyruvic acids and stuff. So that's not a good thing. Physical activity starts slowing down. I'm tired all the time. I don't have the muscle mass anymore. Whatever it may be, all my joints and stuff are stiffening. I'm just sore to get up and move around. But often there is no decrease in food intake. So I'm not as active as I used to be, but man, all that food tastes good, good, good. Pancreas may not even be able to produce enough insulin for their size. So because of that, become possibly into diabetes, like type 2 diabetes. Hormone production for both sexes gradually starts to decrease, and sexual desire may even diminish. but does not cease. But again, there's just not that need, that desire for it anymore. Okay, it starts to decrease and decline over time. Our digestive system, right? Taste sensation even decreases. Oh boy, I'm still putting it down though, right? Saliva secretion starts decreasing. So I get more and more of the cotton mouth that isn't at that first point when you start eating and breaking down the food. We need that saliva to help break it down, right? Ability of the intestines to contract and move the food starts to diminish. So you may become impacted. You get bowel obstructions. Okay, that rhythmic motion just isn't doing its job anymore. And it's harder and harder for me to digest it appropriately. This is why we need to ask about their intake, but also ask about their output. Gallstones become increasingly common. Anal sphincter changes, reduces the elasticity, and can possibly produce some fecal incontinence. So this is why older people may be wearing diapers. Maybe they have, some other ways of having to control that. Maybe they're just not going as much either. Maybe they're just, I don't feel like I need to go anymore. Okay, so they may become, again, like we talked about, being impacted possibly. The renal system, filtration function declines by 50% from age 20 up to age 90. So that 50% decrease from that age range. Kidney mass decreases by 20% over that same span from 20 to 90 years of age. Again, this is due in part to the decreased effectiveness of the blood vessels that supply the blood to those nephrons. And those are just the capillaries that perform the filtering in the kidneys. So when the kidneys are not filtering appropriately, even if it's just simply urinary output, if they're not filtering the medications, they're not filtering the waste to eliminate it, then your body's going to retain it. It's going to become toxic. You become septic. Decreased ability to clear waste from the body. I mentioned that already. And the decreased ability to conserve fluids when needed. So again, the fluid balance will be off. They become dehydrated even. And then their nervous system, central nervous system, the brain weight may even shrink 10 to 20% by age 80. Motor and sensory neural networks start slowing down. Now, again, slowing down, I'm just not fast to react. I don't want to stop driving though. I don't want to lose my independence, right? But that is the possibility that eventually things will start slowing down. The neurons are lost, but doesn't mean you're going to lose any knowledge or skill, okay? You still retain stuff. You'll still retain the information you remembered from schooling and stuff, right? And the skills of how to do it. You know, you're a carpenter. You continue to be a carpenter and stuff. But just the reaction times and stuff start slowing down, right? The sleep patterns change. Maybe I'm not sleeping well through the night, so I have to take naps during the day. Peripheral nerve sensation diminishes. So increased reaction times causes longer delays between the stimulation and motion. So I'm usually quick enough to move my hand out of the way, right? But now as I get older, it's not as quick to respond. Same thing with that hot surface possibly. It's not as quick to respond. Just start slowing down. This is why driving, right? Someone pulled out in front of me or someone walks across the street. That reaction time's like, I gotta stop. And then I put on my brake, right? So it's gonna slow down. And this is gonna also contribute to falls and other types of trauma. The brain mass decreases, making a void between the brain and the outer layer of the meninges. So again, you're gonna have that risk of the brain getting jostled possibly through some type of a traumatic event possibly. And then the sensory changes. Most older adults can see and hear well, may need some glasses or hearing aids, and visual distortions are common. Hearing loss is 4 times more common than vision loss. So anything from like with vision with glaucoma, cataracts, whatever it may be, and then all the hearing issues that may be from environmental problems they've had in the past with, machinery, or they're in the, military settings or law enforcement, firing guns, whatever it may be, that may also build up from their hearing loss also. And then lastly, most people retain high brain function until about 5 years before death. Okay? Then you're going to start seeing some deterioration in brain function. I'm not saying it will lead to any type of dementia or anything like that, but they'll just start seeing that brain function deteriorate. Statistics indicate that 95% of the elderly live at home. Again, this is important to understand when it comes to asking them questions that they can't answer. We're giving them time to answer, but they just can't answer. there's nobody else there that we can get the information from. So we have to go off of whatever Ziploc bag full of medications they have. Maybe they're journaling things. Maybe they have some, literature around, like some journaling that you can get some medical information from them, or who their PCP is or something like that. It's just hard to get it from them because of deterioration in brain function. But again, allowing them time to answer. Maybe you have to, a question in a way is formulated in a way that they can understand it better. Maybe not using such big words, possibly. Either way, giving them time, but it just may not work. So you may have to go a different route. Financial limitations may restrict access to healthcare medications. So maybe they were able to go see the doctor. The doctor prescribed them something, but I don't have the money to get that cardiac meds or whatever it may be, my breathing treatments and stuff. Maybe they don't have the means to go and drive there. So they do a virtual, appointment with their doctor, and the doctor says, yep, you're prescribed this stuff, but they can't physically drive to get their meds. Something like that. And then isolation and depression can be challenges. Again, with geriatrics in particular, you got higher risks of suicide with depression. So trying to recognize, they may not complain about things as much. I know there are some that will, of course, but trying to recognize those types of things, the signs for that, reporting the risks of depression or suicide. Of course, there's also the risks and signs of abuse and stuff. So you always want to report that also. So this has basically been the chapter 7 for lifespan development. Again, please jot down any notes that you may have from what I was talking about, bring it up to the instructor for the first hour of class, and they'll be able to discuss it during that Q&A session. I hope to see you again in class. And until next time, thank you very much.